Hello. So our next session is a fireside chat between Warner Thomas and Abhinav Shashank, the CEOs of two of my favorite organizations where I have had the privilege of personally engaging with both organizations at a deeper level. Warner Thomas is the president and CEO of Sutter Health, where he leads 50,000 employees, 12,000 physicians, 2,000 advanced practice clinicians in Sutter Health's nationally recognized integrated healthcare delivery system. Now, particular interest to this audience is the fact that under Warner's leadership, Sutter Health's innovation focus has reached new heights. In conversation with Warner is Abhinav Shashank, CEO of InnovAccer. InnovAccer is making deep impact in healthcare space with its data and AI platform that touches and manages lives of 60 million plus in US alone, and more importantly, with its innovative suite of solutions, brings the joy of medicine back into healthcare practice. I've known Abhinav personally, and I can say with confidence that in addition to his intelligence, charm, and humor, he is a man of ethics and empathy, a quality that speaker after speaker on the stage since the beginning of this conference emphasized as the single most important quality that leaders ought to have. So let's give a round of applause as we welcome Warner and Abhinav.
Okay, perfect. Can you guys hear us? This is going to be a fun session. After all of the AI stuff, we are going to talk about like real stuff, which is healthcare. So firstly, I think like to welcome Warner. Thank you so much for doing
Happy to be here. Thank you. Thanks for the invite.
Perfect. So I think Warner, let's probably start with a little bit of your journey, right? Like your history. How did you basically end up like getting into healthcare? Today, I think everyone is talking about bio plus technology is probably going to be I think the biggest frontier for the next decade or 2 decades per se. So I think maybe just as a leader of one of the largest systems in California and probably in the country, how did the journey begin? And what are things around that would be great to sort of get started with?
Yeah. So it's kind of weird sitting here in Silicon Valley because I grew up in a small town in Vermont of about 10,000 people. My dad was a welder. My mom worked in a nursing home. And if you had said, hey, you're going to work in, I thought I was going to be a professional baseball player, but that didn't work out so well. So I decided I'd better figure out how to do something else. And so I got went and got my undergrad in computer information systems and accounting, and ended up working in a place called Ernst & Young. It was Ernst & Winnie when I got there, but Ernst & Young, and got on a healthcare track. Never really had an interest in healthcare, kind of got into that world. And, growing up, it was always about, my parents were hardworking, blue-collar family. It's like you work hard every day, and you persevere and you never stop. And that's kind of how I've kind of had my career. I spent about 4 or 5 years at Ernst & Young, went to one of my clients, and there I met my mentor, a guy named Tom Wilhelmsen, who believed in me a lot more than I believed in myself, and kind of gave me my first shot to kind of run my own business. We started a physician group there it was a small health system in southern New Hampshire. And from there, that group grew, and I was there for about 10 years before I went to New Orleans and spent 24 years in New Orleans before I came here to Sutter. I've been at Sutter 16 months now. And I would say the formative event in New Orleans, besides growing the system from when I got there it was about 300 million, when I left it was about 8 billion, was going through Hurricane Katrina. And I was the president and COO of the health system there in New Orleans, one of 3 that stayed open during Katrina. Lived in my office for 3 months because I didn't have power. And going through that, you realize that you can figure anything out and you can go through anything if you got the right team and you got the right attitude. And so I think that carried us over when I was at Ochsner. And I carry that today, that whatever problem we have, as long as we work together as a team, as long as we stay focused, as long as we keep purpose in mind, that we exist. When I was there at Ochsner, we exist to take care of patients. Here at Sutter Health, it's about patients first, people always. We exist to take care of our patients. We exist to take care of each other. That's why we're here. And I think that purpose, keeping that in front of you, allows you to drive with a positive intent, allows you to keep a positive attitude regardless of the noise going on and the challenges going on around you. So to me, purpose in what you do professionally and personally is critical to the success of a leader.
That's great. There was a lot to unpack there, though. So I think you talked a little bit about role of mentors, which is I think has been true for a younger founder, I think like me. We started the business when I was 24, and forget about knowing anything about American healthcare. I did not know much about America, given that we started in Delhi.
Right.
And I think the role that mentors basically played for us was incredible. And you touching on that, as the initial foray into healthcare is I think critically important. So on that front, right? Given that a lot of us basically are here from the tech community, and healthcare basically seems pretty daunting from the outside to do anything in, right? How do we basically even approach something of this nature? You've sort of really taken leadership roles at Ochsner and then Sutter, and how do we sort of even approach something of that nature per se?
Yeah, I think one of the things is to try to understand, what is your customer, or what are you trying to accomplish with patients? And I think one of the challenges we have in the tech industry today, as it relates to healthcare. So I went to the HLTH meeting, back in November or whatever, it was in Vegas, and I walked into the showroom and I saw 4,000 booths, and I was like, this is what's wrong with healthcare, and probably some of you were there, I'm sorry. But patients don't want a fragmented experience. They want an integrated experience. They don't want to have 30 apps on their phone that they, for diabetes, for hypertension, for wellness. They want to have an app that they can go to that kind of helps them get to one place. So I think you have to think about integration versus point solutions, and that's kind of what we're doing at Sutter Health. We have a point of view that patients and our view of successful systems of the future, they're going to have a large ambulatory-focused, kind of outpatient-focused, physician-driven, physical network of assets, but it's going to be interfaced and connected to a digital ecosystem that you can move back and forth between, omni-channel, right? And, I think patients do not want a digital-only solution. They want pieces to that, but they want to see, we see this today. Telemedicine visits are declining, not increasing. Patients want to be seen.
Right.
And so I think that, you've got to have both. And hospitals, yes, people are going to continue to move out of hospitals into the outpatient arena. We definitely are doubling down on the outpatient area, and with probably many of you go to the Palo Alto Medical Foundation. You may be patients. If you are, thank you. But at the same time, they got to have a digital connection. Things that we do in other industries, like booking appointments online, getting reservations online. You want to do that with your clinical situation. You want to book appointments online. You want to pay your bill online. You want to be able to look at information online. You want to be able to order things online. That's just the way it is.
Right.
And so I think that's the pivot that I think health systems need to make from just being a physically oriented, organization to being digitally enabled as well. But I think as a digital and as entrepreneurs here, you have to understand that a point solution is not going to work if you got 40 point solutions. That's going to be very difficult to get physicians to use or to get patients to use.
Right. And you definitely talked about the role of collaboration and working sort of together. How should a tech audience and entrepreneurs basically think about integration and working with systems like you? As a startup entrepreneur or as a tech person, what does that collaboration, where does it start? How do people sort of even approach it the right way? Because most of us in tech don't really know how the health system sort of really work. So what does that sort of look like?
I think that's one of the things that, probably most folks, if they're bootstrapping, they have their own money, or if they're taking private equity or venture money. My question would be, what access as a venture fund, what access do they have to health systems?
Right.
what access do they have to, people that could be potential customers? It's great if they can write checks to you, but then, how are they going to help you run your business, and how can they, help you make connections that you don't have today? We're an investor in several funds. One is Defined Ventures, out of San Francisco, and yeah, I mean, we look at all the companies that, Lynn Chow runs that fund, and we're looking at her research, looking at the companies she looks at. Some we use, some we don't. But, I mean, we want to constantly learn and see what she's investing in, what she sees, what new solutions are there. So I look at it as tuition for education, as well as opportunity for, new ways that we can work with folks. I mean, truth be told, so I spent, like I said, 24 years in New Orleans at Ochsner Health. One of the reasons I took this job, there's many, but one of them was the proximity to Silicon Valley.
Right.
And I know that, the digital innovation and the work that's going to be done a lot of it's going to be driven through other hubs, but obviously through this hub here in Silicon Valley. So Sutter's presence here and our ability to partner with digital organizations is large, and we want to be known as a digital leader in healthcare, period. We have not been. We got a lot of work to do there, but that is kind of what we want to do. It's why we built an innovation center in San Francisco. We want to partner with various companies. And, we're going to be selective about it. It's not going to be everybody. But, and we're also investing in digital funds that will allow us to kind of get access to companies, know what they're doing, and decide who we want to try to connect with.
That's great. So that's like one set of questions. The other is about you lead an organization of 53,000 people, right? Like, it's just like daunting. And like, it would be great to hear a little bit about like leadership and how you basically like think about like culture and like bringing all these things together. Health systems, in my view, are incredibly mission oriented. Yeah. And how do you basically translate that into like a 53,000 people org? Like, how do you make sure that the person who just got hired yesterday sort of like believes in the same things and is representing culture that you're sort of like really thinking about as a leader in general?
I think part of it is the culture that you create in the organization and the belief system that you create. And I think as a CEO, I mean, I need to kind of set that agenda, with my team and with, other leaders about, what are the things that we're going to show that we care about or not care about, right? And, for example, when I got to Sutter, one of the things I knew is that we didn't have as good a relationship with our physicians as we could or should with some of our physician groups. So we started a physician strategy cabinet of, key physician leaders that I meet with, every month, because that's an important constituency. We started town hall meetings with our employees every month. I mean, not earth-shattering, but it wasn't done before.
Right.
So we're totally transparent. Open the chat, let the questions roll. Some were painful, I got to admit. But it's about transparency, right? It's about just laying it out there, this is what's happening. So that starts to build trust, right? And then this point around purpose, continuing to reinforce to people why we're here and what's important. People went into healthcare to take care of people.
Right.
And if all you talk about is money, or all you talk about is process improvement, or all you talk about is growth, I mean, I try really not to say the word growth. I talk about serving more patients.
Right.
It's the same thing.
Right.
But to somebody that's a clinician, they hear very different things. Right. It's about taking care of people, not just about growing. So I think this idea of, how you communicate, what words you use, and I always say that whatever you spend time on and what you put money into is what you care about. Right. If you don't put any money in leadership, you probably don't care about it.
Right.
You can say you care about it, but then you say, well, what's the budget for it? 0. Okay, you don't care about it, right? So I think you got to spend money and spend time on the things you care about. We do a big leadership meeting, twice a year. We have one coming up in June in the Chase Center. And, some people go, oh, that's a waste of money. I think it's the best money we spend. Getting our people together, getting them excited, getting them aligned, having them understand the vision, having them feel the energy, of kind of where we want to go as an organization. So that's all about driving culture and all about driving belief in what you need to do. And So, it's funny. One of the things, going back to the whole Katrina situation, you find out a lot more about leaders and about an organization when the chips are down, not when things are going great.
That was going to be my next question.
Yeah, and the chips were down. We didn't lay anybody off. We were losing money like we were drunken sailors. It was crazy. I mean, it was just like, and we were spending a lot of money because we had to, buy all kinds of stuff. I won't bore you with the details. But we didn't lay anybody off because our belief system was that's not what we do.
Right.
And we're going to need these people when patients and people come back, right? So I think that's also, something we all have to think about. And you have to think about as entrepreneurs. And I know if you run out of money, you got to make tough decisions. I get that. But I think that, what drives those decisions, I think, is important. It's honestly why I like being a not-for-profit, because I don't necessarily worry about quarter-to-quarter earnings as much.
Right.
I can make longer-term investments. I can think about things differently. We can invest in things that don't necessarily make money, like mental health and things like that are critically important, but you won't see a lot of for-profit, large healthcare systems putting a lot of money in mental health because it doesn't make a lot of money. So we are doubling down on that. We're putting 5x investment in outpatient mental health because it's important, and we can do that because of where we are.
And like talking about mental health in general, right? Like if we look at the Bay Area, like we're probably one of the richest places in America, but I think the amount of inequity that you basically see on the streets of San Francisco and Oakland and it's just mind-boggling, right?
Yeah.
I feel like health system CEOs play such a large role in societal management and as well. So how do you view I think the growing inequity and what are things that you as a leader are sort of focused on?
Yeah. So we have an Institute for Advancing Health Equity, which I think has done some really good work. But we got a long way to go.
Right.
I would say that number one of the things that shocked me about healthcare in Northern California, just didn't know it, is that access to healthcare in Northern California is, I'll just say, very challenging.
Right.
It's very challenging. More so than kind of where I came from, which, Louisiana is a much poorer state than Northern California, and access was actually better there than it is here. Part of it is we don't train enough clinicians and physicians. So we're fixing that and working on that. But I think going back to your point around equity, look, the way the healthcare system works, and I didn't make the rules, they just are what they are, is that, commercial insurance essentially underwrites Medicare and Medicaid.
Right.
That's how the system works. And you have to see enough commercial patients to underwrite Medicare and Medicaid. So the more commercial patients you can see, the more Medicare and Medicaid patients you can see because it underwrites,
Right.
And I think that's how we look at it. We also, are in our community benefit area, we're continuing to double down on really a couple of different areas. Workforce, access, and mental health. And so we're investing more in the federally qualified health centers to help them grow and help them expand. We're doubling down, kind of our mental health area. And then certainly on workforce, we got to go upstream to the colleges, universities, technical schools, and into the high schools.
Right.
To have kids understand, you don't have to be a doctor, a nurse practitioner to get a career in healthcare. We hire a lot of tech people. We got a lot of finance people. We got a lot of people in HR. And so helping people understand, there can be a path for you in healthcare. And we need to celebrate people that are willing to graduate and go into a 2-year program or become a medical assistant and then help them build their career. So I think this idea of ending generational poverty and helping people get on a path where they can go from an entry-level job to the next level to the next level. In my previous life at Auction, we actually did that pretty well, and I think we got a lot of opportunity to do that here at Sutter, and I hope others follow. We're happy to share our playbook with anybody, and if other people want to do it, fabulous. We'd love to see other people do it because it's just going to make the whole region better.
Right. And I think healthcare has evolved so much over the last few years. There is the payment model transformation that's happening, more and more people like I think like we're probably starting to get paid to keep people healthy rather than basically treating them when they're sick. Like, and that's such a meaningful transformation, like in the payment model. And so that's basically like I think like coming to the fore. There's all of like big tech and like pharmacy and everyone wanting to sort of like be providers. There is so much change in the ecosystem, right? Like, and so how do you as a leader really think about like all of these sort of like changes? How do you sort of really continue to like advance the mission and not get like I think what's happening?
Yeah. A lot of Tylenol. No, just kidding. No, I would say, if you don't take anything else from this morning, I would take this fact away. This is really important for all of you. 11,000 people every day age into Medicare. Every single day.
Right.
With the aging of our population. Every day that happens, every physician and every hospital in America takes a pay cut.
Right.
Every day. And that's going to put massive pressure on the delivery system in healthcare. And what happens when people go into Medicare, the profit pools move from providers to insurers.
Right.
Because the profit pool in Medicare, hospitals and physicians essentially lose money in Medicare, insurers make money. So as a provider and as a health system, if you don't go upstream into the insurance and into the global payment world, you're just not going to make it long term. You've got to figure that out. That is a massive pivot that has to be figured out. You know, we're doing it. We're not good at that today. I mean, we're building the muscles, but that is a massive macro issue that's, you know, impacting everybody. Back in Louisiana, where I had so much Medicare business and not a lot of commercial business, here we have a great market. We've got a lot of commercial folks, helps underwrite Medicare, which is a smaller piece of, you know, the services we provide. Louisiana, you don't have that.
Right.
So we had all of our Medicare business on global payment, all of it. Now here's the benefit of global payment. It unleashes innovation.
Right.
So if you try to take innovation and put it on a fee-for-service system, it's hard to do that. It's hard to get that done. If you can move to global payment, even if it's in a certain population like Medicare Advantage or the Medicare population, you can start to take cohorts of your patient and innovate with them and do things differently. And I think that's where we have to pivot with Sutter, with our Medicare Advantage and our patients there. You know, we have a lot of that on global payment, moving more of it, but then getting good at managing the risk and integrating with the insurer in the right way.
Right. And like, what's the kind of innovation that like some of these value-based care payments, and for like I think like tech audiences, like value-based care is like I think where you're paid like a fixed fee to take care of a population set.
Yeah.
Right. Like and then like all the cost downstream is basically like to be managed by the health system. So you get like paid in advance, but then like I think like a lot of the innovations can sort of like happen with the full dollar amount rather than basically like just like the 3 cents that people were sort of like paid for like the primary care visit, right? Like, so it's great for like I think like provider groups to really have access to the entire dollar and therefore like innovate much more meaningfully. And like it would be great to hear like some of the things that like I think that you're seeing, partner.
So here I'll just give and now I'm way over my skis, so I'm way above my pay grade, but I'll give it a shot. How about this? Okay, so hypertension.
Right.
People that have out of control blood pressure. For folks that are out of control, probably they're probably in control maybe 20-30% of the time. We're building a model now. We've got good history on this that we'll have ready in Q1 of next year. That we will move our patients that are having trouble with their blood pressure control to a digital model that we can monitor them at home. So instead of coming into the office 4 times a year or whatever and getting your blood pressure taken and having the nurse practitioner, physician, whoever sees you decide whether we should monitor or move your medicine at all. Getting 4 blood pressures a year, we send you home with a wireless blood pressure cuff that's synced to your phone, that's synced to our Epic platform, that we have AI and health coaches behind, clinical pharmacists behind, to essentially get 4 to 5 blood pressures a week. And if you're not doing it, we ping you. Like, hey, you haven't taken your blood pressure lately.
Right.
Hey, your blood pressure's up. We're going to reach out. Did you eat something different? Are you taking your medicine? Are you walking? Are you doing the things you ought to do? And what we've seen with this model is we go from about 20, 30% to about 80% control. We see ER utilization go down 30 to 40%. We see hospitalization go down 30 to 40%. Drug costs actually goes up. Why does drug costs go up? People take their drugs.
Right. Medication is there.
Because a lot of folks, they take their medication the first couple weeks and then they forget it. They stop, whatever. We're human, right? I'm probably the worst patient, so I can, speak from experience. So, and the cost of that patient goes down about $200 per member per month, especially for the Medicare population.
Right.
And if you're in a global payment, you keep those dollars.
Right.
If you're in a fee-for-service market, that doesn't make sense because you lost the ED utilization, you lost the visits into the clinic. So you've got to change the payment model, otherwise the innovation doesn't work.
Right.
So yes, moving to keeping people well, helping people live healthier, more productive lives, I think that's directionally where we've got to go. And the payment system facilitates that. I think it's probably the single biggest issue we have in America is the payment system. Right. And I'm not saying we can just change it because you can't. There's a lot of minutia to that, but it is a big issue, especially in primary care, quite frankly. And we've got to, and primary care physicians, their job is, very, very difficult, very difficult. And so we've got to give them new tools like this, continuous care monitoring, AI to look at messages, tools like, I know folks were here yesterday with, Laura Wilt and Shiv Rao from a bridge with, the ambient listening to kind of, frame up the note for people. These tools, I think, will help make primary care more doable and allow us to retain and then recruit more people into that.
Makes sense. Now, I think, given that we're short on time, one final question that I would sort of frame to you, after all of the hype of fintech and edtech and all kind of tech, I feel I think this is health tech's moment. Everyone's sort of been talking about why bio meets tech is sort of I think the next evolution. So what are themes that you are most excited about as a leader?
So it's interesting. I co-taught a class the other night at Stanford with a guy named Jeff Immel who used to run GE. And it was a little bit of a case about healthcare and about Sutter. And he was saying, we put all these IT systems in health systems, and the value creation has been essentially zero. And I don't know if it's been zero, but we've spent a lot of money and we haven't gotten a lot of value back yet, right? I think the point is now. The time is now for this to happen. Digitizing our medical records and whatnot is probably 10%, maybe 15% of the value. Right. The value now is we have all this data, we have these new capabilities, now what do we do with it? Right. We know a lot of things about our patients that we could be more proactive about how we take care of them, but it's going to require the right technology and more importantly, interfacing with our physicians and clinicians in the right way, to help them, do a better job here. So I think that's part of it. But I think how we use data, how we do outreach to patients to, connect with them differently, how we check in with people so they don't go back to the ER, right. How we help them navigate so they don't go to ERs and they go to primary care, they go to urgent care, they go to a lower, acuity care. So I think there's a lot of promising things happening here. I think AI is going to have a massive impact on healthcare. I really do. All the insurance and coding and billing and collection. We have 2,500 people that bill and collect and work on, denials and all that. 2,500.
Right.
And frankly, a lot of them, their job's virtually impossible because, insurers have their view of whether they pay providers or not, but we won't go down that road right now. So maybe another time.
Yeah. No, but this has been fantastic. I think as all of you sort of heard, I think health tech And healthcare at this point is like at an inflection point. There are so many themes that are basically coming together. There is a big payment model transformation. Like it's probably one of the most mission-oriented like themes that a tech entrepreneur can basically, I think, like follow. There are leaders like Warner who are basically like all like, come on in, like let's basically build stuff. So this is sort of like, I think, like the time for like health tech, like for tech entrepreneurs and AI entrepreneurs in some way to engage with like health systems. And thank you, Warner, for sharing some of those like insights and thoughts with like, I think, like the broader audience.
Thank you. Appreciate it.
Thank you.
Thank you.
Thank you, sir.